Hi there, I'm Chandra Wilson, and I'm going to tell you a little bit about our clinic philosophy in the urologic oncology clinic. First, a little bit about me. I was born in Colorado and went to high school at Bear Creek High School, and I did a lot of ballet growing up. I thought I might go to New York, but ended up going to college at the University of Denver. I then got to go to St. Louis and go to WashU for med school, and then ultimately ended up in urology at the University of Southern California. Finally, at age 32, it was time to look for a job, and I decided to come back home to Colorado. I've been so lucky to get to work here. I've been now at the University of Colorado for 13 years. My first year was a fellowship in urologic oncology, and then I've been here 12 years. I have two middle school kids, a boy and a girl. My husband is George Sparks. He works at the Museum of Nature and Science. And I'm going to tell you a little bit about the other people that you'll be meeting that are part of my team. First of all, this is Tala Tallier. She is my physician's assistant, and we work very closely together. Our philosophy is that we can bring different strengths to seeing you on the first visit. So on the first visit, Tala will actually act as a scribe, even though she's very well versed in medicine and urologic oncology and that sort of thing. She's actually helping pull together records, and while we talk, making sure we don't miss anything and ending up with a perfect note that I add to and we send back to your referring doc. So she really helps with communication. She also does follow-ups for me, so I love being in the operating room, and she is very competent and very good at following patients that have been cured. So those are the two areas where you'll work with Tala. Also the front desk. We have lots of great motivated front desk staff. They can make appointments. They can make appointments for cystoscopy. They can make appointments for clinics. They don't make appointments for surgery, but any other appointments they can make for you. Their phone number is 720-848-0170. Jolene, on the other hand, she does schedule surgery. You may not meet her. She's in the back trying to get insurance authorizations and that sort of thing. She is very good at her job. Her number also is the main number for our clinic, which is 720-848-0170. She can answer any questions about the surgery schedule. Just a few more comments about our team and then our philosophy, and then we should be coming in to see you very shortly. So another person on our team is the nurse navigator. This is a nurse that gathers all the records from where you may have had previous biopsies, your primary care records, and then helps make sure that you get into the right appointments. A lot of times these can be on the same day. The nurse navigator also, if we want to do a second opinion, he or she, we're in the process of transitioning there, can help get the slides and that sort of thing so that we can all work as a group on a Tuesday morning to do second opinion. So if you have any questions about if your records are here or if your case has been presented at second opinion or where you are on the list, you can call our main number, 720-848-0170, and talk to the nurse navigator, and then you'll be able to get an idea where you are on that second opinion list. What are second opinions? We actually have a second opinion conference or a tumor board like many academic institutions do. This is multidisciplinary. That means there'll be surgeons there, there are radiation oncologists there are oncologists, there are people that run studies there. You don't need to be present. We present these cases without your name. It's every Tuesday at 7 a.m. We try to get back to you by the next day or 48 hours later. Sometimes we'll have you make an appointment if it's going to be something that requires a lot of information. But sometimes we can get a little bit different twist on your pathology just because we do certain types of cancers in higher volume than outside facilities. So that's the benefit is our pathologist, one of our pathologists just does bladder cancer, another one just does prostate. So we may get a more specific read on the pathology. There's more options with the people that do research. We can have everybody there in the same room to make sure we're not rushing into surgery or chemo without everybody talking to it. The downsides are there occasionally is a small charge associated with this, or it may delay getting to the operating room or getting chemo immediately, but most people think that's worth it. Also very important to our team are our nurses. Robin Wiesman and Vicki Piner are our two nurses right now. Again, their number is our main number, 720-848-0170. They can answer basic questions about anything related to urologic oncology. Their hours are 9 to 4:30, Monday through Friday. So if you call Vicki or Robin, just to kind of give you some guidelines, you're still going to use your head, but these are times when they might tell you to go to the emergency room. If you're feeling so lightheaded, you might faint. That might be a sign of infection or that you're really dehydrated. If your heart rate is racing and it's faster than 110, if you can even time it for a minute and you're faster than 110 and you don't have a history of irregular heartbeats, that can be a sign that you have an infection also. So it's good to get that checked out right away. If you have a higher grade temperature, so anything less than 102 is may be viral, maybe your lungs aren't fully expanded, but higher than 102.5 is usually a bacterial infection. So we do recommend you seek treatment for that. If you are talking so quickly that you can't get through it because you're short of breath, sometimes that can be that you have water on your lungs or a clot in your lungs. So that would be another time that we'd be worried if you can't speak a full sentence because you're short of breath. Also, something that doesn't seem like it should be dangerous, if one leg is swollen more than the other one, and it sometimes can be painful also, that could be a sign of a blood clot. And it's not dangerous there, but it can go to your lungs and become quite dangerous. So swelling of one leg, especially associated with pain, is time to go to the emergency room or see someone that day. Certainly obvious, if you have any stool-type material coming from your wound, that could be a major problem with surgery. Chest pain that feels like you're having a heart attack, neurologic changes that may suggest a stroke, or obviously if you just can't pass urine at all, this could be an emergency too. Other things that are less urgent that you can call our nurses about include blood that's in the urine. This is pretty normal after most of our procedures. As long as the urine looks like Kool-Aid and you could read the newspaper beneath it, it is usually just like food coloring. A couple of drops can make it look pretty bad, and with some hydration, it generally stops. You can still call our nurses, but in general know that it always looks a lot worse than it is. If you've had a stent put in, expect that when you go to the bathroom, you are going to feel pressure that can be sharp and excruciating up in your kidney. That pressure probably won't go away until the stent is removed. Also, burning and frequency of urination can be associated with these stents as well. If you do get burning and frequency and you don't have a stent, that can be a sign of a urinary tract infection. So that's another good time to call our nurses at our main number. They can do a urine culture for you, and we can get you started on antibiotics fairly quickly by working with our nurses. If the wound opens just a little bit, most of the time that'll fill in with some cells that grow inside there. So if you see a little pinkness, if you see a few suture tails or something like that, those tend to dissolve. So these are not things to be overly excited about, but you're certainly welcome to call our nurses if there's something that doesn't seem right. If you get mild swelling of your legs bilaterally or of the scrotum, these are normal things after surgery as long as it's mild. It tends to resolve with time and with elevation. And finally, if you see some bruising around where the surgery site was, this is expected and tends to go away with time. Things that you definitely need to call our nurses about right away, because they will get in touch with us, are if a tube comes out that you went home with after surgery. If the volume of what was coming out of that tube changes, or the consistency, that it was clear and now all of a sudden it's bright red. Those are times we really need to know about it that day. We may need to take you back to surgery to put it back in. Those tubes are there for a reason, so those are important things to get in touch with our nurses about urgently. If the wound looks red or feels hot or is warm to the touch, that can be a sign of infection. A lot of times it'll kind of turn white if you touch an infected wound. So hot and warm and red, those are signs of infection on the wound. Our main number again is 720-848-0170. That's our nurses that are there in the clinic. If it's before 8:30 or if it's after 4:30 or if it's a weekend, call our residents. They are part of our team. They can be reached through our main number, 720-848-0000, and they'll just ask for the urology resident on call and they'll take care of you. Now remember, if none of these seem quite right, these are just guidelines, and always use your best judgment. So finally, as far as our philosophy in clinic, our special interests are the people. I love meeting people. I love helping people. I love understanding them. And kind of as an extension of loving to work with people, I do help with research. I help students that want to become urologists or want to become researchers. We help by taking all the tissue from people that have had surgery and putting it in mice or testing it for chemotherapy. I also love teaching students, so these are extensions from loving people. I also love safe care. I've taken MBA classes to try to decrease those sort of things that can come with surgery, like unintended infections and urinary tract infections and that sort of thing. So safety is always number one. Communication is a personal goal of mine. I think we have all this fancy technology in medicine, but sometimes the biggest hang up is trying to get communication from the referring doc to us or vice versa. So we're pretty meticulous about faxing all the records ourselves, Tala and I writing our own notes all the time, and just making sure we kind of overlap and dovetail to make sure that communication is good with your team once you get back home. And then finally, something that's important to us is very effective care. I'm not at all competitive or anything as a surgeon, but when I first started at the university, our overall survival for invasive bladder cancer was 50%, and now it's about 75%. And that's probably by following these guidelines. And I'm going to give you a link to that, but the guidelines have been established to help us select the right patients for the right operation so that they do the best and get the best sort of treatments. So where do I love to be? I love to be in the operating room. That's when I feel like I'm in the zone. So my schedule is on Mondays I have administrative meetings and I do research and help students and do teaching. I do surgery on Tuesday, Wednesday, and Thursday, and then I'm in the clinic on Friday. So if you need to get in urgently, you might be seeing our PA or our nurses, but that's kind of my schedule because I feel like that's where I can help people most is when I'm in the operating room. Our philosophy is that of respect, being patient-centered, having joint decision-making, and having a good match between the patient and our philosophy. So what I love doing is cancer. That's my fellowship. So that's what most of my patients have. I don't necessarily treat females with incontinence. We have somebody that does that. I don't treat bladder pain specifically. We have an anesthesia team and a pain team and some good people that do that in Denver. We do have a team approach, so if you're not interested in working with the team, we may not be the best sort of match. And we think respect for all people all the time is important. So this is the last thing about how do we get these best outcomes. We tend to follow the NCCN guidelines. So those are the National Cancer Consortium Network guidelines. And these are guidelines that have come together by leaders in urologic oncology that tell us if you have an invasive tumor, is it best to start with chemo? Which patients should get radiation? How many nodes should we take? And these have been studied for years and conglomerated by leaders in the field across the country so that patients, no matter if you're getting surgery in California, New York, or in Colorado, you're getting the same sort of idealized treatment. And then we will specialize it based on your particular necessities. But at least this gives us some framework to work with. These guidelines, I've created the link here, and you can click on the link so that you can be familiar with the guidelines. I actually encourage you to be engaged. I think the more you know, the more we'll be able to work together and speak the same language. In that vein, I've created some videos on bladder cancer. So if you have bladder cancer, there's a link to our videos, which has helped a lot of patients be able to share this with their family or come in and ask important questions, since we usually only have 15 or 20 minutes together to talk when I meet you the first time. So I think this gives you the best outcomes when when you're engaged and I'm engaged and we're patient-centered, when we can offer a second opinion, and when we can offer a multidisciplinary approach. We look forward to meeting you.